Good evening. Welcome to another episode 4 of Blue Table Talk. My name is Tawana Collins Boo.
My name is Arnell Brady, speech language pathologist.
And today on Blue Table Talk, we're going to talk about how to tell someone their child might need to be assessed for autism. So I'm going to talk about a couple of parents and grandparents messaged me and asked me, well, how do I tell someone, my daughter, my granddaughter, my grandson, my son, that their child might need to be assessed for autism? Because I just don't know how to tell them because I don't want to hurt their feelings. So I thought about it. So I said, when you love someone, you just tell them the truth. So I think you should just tell the family member, your son, your daughter, granddaughter, grandson, that you think that they need to take the child to be assessed so they could find out, so you all could find out if the child has autism. Because the quicker you get assessed, the child get assessed, the quicker you can start the early intervention and start therapies and services for the child. So I say, even though the parent of the child might be mad, but if they love you, they won't be mad for long. So I say just go ahead and tell your daughter, son, granddaughter, grandson, just tell them, hey, I think something wrong with my grandchild or your child, or if it's your friend, just tell your friend that I think something wrong with the child and maybe you need to have the child to be assessed for autism. So when George was younger and I had a friend to tell me that she thought something was wrong with George, I was upset. So I was upset and angry. So I didn't know how to deal with it at first. So I was like, nothing is wrong with my child. But it made me look at the situation and it made me think about, okay, I need to have my child assessed. So, Mr. Brady, how would you handle the situation if a parent came to you and asked, how would you tell a parent, or if it was a grandmother or a friend, how would you tell them to tell a parent or a child, someone, that their child needs to be assessed for autism?
Well, Mrs. Booth, as you have said, that is a very, very sensitive situation. I say it's a very traumatic situation when you have to tell a parent that something is wrong with their child. No parent wants to hear that. Every parent wants for their child to be well and happy, learning, developing, because the end goal is for that child to be independent and to be able to function on their own. And so when you tell a parent that you think that there is something wrong in the development of their child, then that parent usually goes into shock because, as I said, nobody wants something to be wrong with their child. I have many cases that have come to me with parents concerned because the child was not speaking as the expected age at the expected level. And I have seen in some of those children some of the signs and symptoms of autism. And I'm always very careful in indicating that to the parents. And I have suggested further evaluation, continued diagnostic speech therapy, so that we, over, say, a course of 6 months, can get a good representative sample of what the child can do. Because as we all know, one of the telltale signs of autism is a significant deficiency in language, in communication.
Okay. So I want to talk about when the friend told me, hey, George was just pointing, and I knew that George was my child, so he was just pointing. So I felt like, okay, that was fine for me. But then my friend came over my house, and she was like, I think he should be talking. He's just pointing, and you giving him what he wants. I was like, okay, so I know what he wants. So she was like, that's, I don't think that's good. He need to be telling you and asking you for what he wants. So when my friend left, I was very upset. I was mad. I was like, I'm not calling her anymore. But it made me look at the situation, and then I started noticing he's only pointing. So I'm like, well, maybe I should take a look at this and find out what's going on.
Because you did have an older child.
Yeah.
Who's perfectly normal.
Yeah. And that's Jaquan, my oldest son, he was older. So I was like, I don't know what she's talking about. Everything good. I got a son, he's good. So it made me look at the situation. So it's programs, you can Google them, Child Find. You can Google Child Find, and they have them at the public library. And you can Google the nearest one to you, and you can look up the times, and they might even have open when you can just go in there, testing dates. So, and the Child Find will help you get your child assessed, your grandchild, or whoever the child is that you think that might need to be assessed. So Child Find was a good tool for me. So I went to the Child Find, and they assessed George, and they was like, yeah, I think George has autism. So I was like, wow, I never knew what autism was. I was mad, like I said, very upset, and I will say it took me to a little depression. I was kind of depressed in the beginning, and I was just like, what do I do? So
some parents, oftentimes one of the initial responses is anger, denial, confusion is one of the signs, and parents will seek out looking for evaluations that will give them a positive outlook. But if it is autism, it's not going to be denied. And so you have to keep searching and finding the right understanding, because you have to realize that autism at all ages and all stages of severity can show positive responses to treatment.
Okay.
And this is why in some cases, the sooner you can accept that diagnosis, you can begin to move forward to that treatment.
Yes.
And we have seen that they respond best to treatment that addresses their social relatedness, their ability to interact with people, their language. Start developing that language, because nobody should have to teach us how to talk. We should be able to develop speech just by being around it. But we can help a person develop speech. So it is best that as soon as you can accept that diagnosis, move on. Because one of the good things about it is that we have seen that some people have accepted the diagnosis, move on to treatment, move on to interventions, and the child shows so much improvement, they come out of the diagnosis.
Yes, and that's true, because when, like I said, after I got the diagnosis and I was depressed and angry, upset, and so, but I sat around in that depression for a minute, and then I just was like, I got to get out of this. I have to get my child help. And that's when, at the time, it wasn't Google, so So I think I don't know if I looked you up in the phone book, or I think I looked on the computer, because I'm always, when I'm looking for something, I want to know the best. I think I look best speech therapy in Chicago, but because I want the best, because it'll help you a lot. So, but I got your number, and I called your number, and I came to you, and yeah,
we were on Cottage Grove.
Yeah, yeah. You was on Cottage Grove at that time.
84th and Cottage Grove.
And I came to you, and I'm pretty sure when I came to you, I know that I was broken.
And you kept coming back.
Depressed and emotional.
And crying.
I was crying every day, emotional, but I knew that I needed the help. And you reassured me that, hey, we're gonna get this help.
Well, we have seen our best results, because it seems that in the brain of the autistic child, they develop a lot of what we call short connectivity in the brain. And in order for us to really be able to function, we have to have long connectivity. And if we can set up an intervention program that's going to help to foster that and help to stimulate that, a lot of these children do quite well.
Yeah.
And even at any age, they do quite well.
Yeah, because I remember you gave me, I don't know what the paper is called, so I don't want to say the wrong name, but you gave me a blue form, I never forget, and you said, take this to the school.
Okay.
And they gonna let George in the school with his form, and I was scared. So that you gave me it the first time, and then when I went back to you, you said, did you go up to the school? I said no. You said, what's the problem? I said, I'm scared. You said, you have to take this form to the school to get George some help, because although we doing our speech therapy here, he have to get in school to start his early intervention in school. And I took the paper back to the school, and it said that they had 60 days to allow George to attend that school. So you know the form I'm talking about now?
Yes.
That form. And you said they're not going to turn you down once you get them this form.
Right.
So I gave them that form, but they did make me wait those 60 days. But I'm so glad that I went to Brady's speech and you gave me that form, because I would have just been sitting around trying to figure it out, or somebody would have maybe, but I'm so glad that I came to you and you gave me that form, and I was able to start early intervention and speech therapy at your office for my son. And we haven't stopped ever since, and it's 15 years later.
Okay. All right. So that process is quite simple. Oftentimes I will tell a family, let's do diagnostic therapy. That is, let's do a combination of assessing and treating all at the same time, especially with very, very young children, because they're constantly changing as they grow and develop. So that process is quite simple. But what you have to do, you have to be consistent in it. You have to be consistent.
Yes.
You have to follow up. And if you put in the time and the effort in the beginning, it'll pay off in the long run, and you won't have to put in as much time and as much effort. So that process, you have to make some sacrifices.
Yes, and like you said, you have to put in the work. And you will see the results in the end if you put in the work. And it's easier, like we talked about on the other episodes. I had to come every day.
Every day.
But it's not like that anymore. The services that they have available today is more easier than back in the day when I was searching for all of my services.
Before we had iPads.
Before we had iPad and all that, we had to come to the office every day, twice a week, three times a week. But I would still say, even though it's easier, just stay consistent with your services for your child, because staying consistent is making your child progress.
And the therapist has to share the plan with the family. The therapists have to literally give the plan to the family, because they are doing way more work than the therapist is doing. They spend way more time with the child than the therapist. Okay. So if you're just taking your child and letting the therapist do some work in that little time, the outcome is not going to be great. It's what the parent does at home in terms of follow-up, in terms of establishing some consistency and some predictability in what is going on. And the children respond very, very well to that.
Okay. So, like I said, you can Google Child Find Services, and they will tell you that, I think they hold it in Chicago Public Library. So you can Google them, and it'll give you all the addresses of the libraries that offer the Child Find Services. And the one nearest to your location, you get them a call, and they'll set you up an appointment, or it might be open where you can just go on a certain day and go get the child assessed. But I would say tell a person that they need to get the child assessed so we can start the early intervention, because early intervention is a must, and it is really helpful in the progressing of the child.
Mm-hmm. And as you said, Mrs. Booth, to sort of wrap it up, by not telling someone that you know and you love, or just someone that you're acquainted with, not telling them, you're doing more damage than you would if you tell them and they have, say, a negative response to you telling them. As you said in the very beginning, at least it raises their consciousness. They'll be more aware of what's going on. And in no doubt, they'll come back to you and ask you for more help.
Yeah, they'll be mad. They'll be mad. I was mad, but it helped me in the long run. So even though they'll be mad at you, but when you love someone, that madness won't stay around for long. You'll all be back talking and going forward, moving forward with getting the help for the child. So again, go to the Google the Child Find and find a location. And after you get the child assessed and they assess them and it's found to be that they have autism, start your next step, which is early intervention, and coming over to Brady Speech, 5228 South Blackstone, and the number is 773-493-4000. Again, the number is 773-493-4000. That's the Brady Speech. And if you want to reach out to me, leave a comment or a message, you can reach me at All Families United, and that number is 708-320-9018. Again, that number is 1708-320-9018. Thank you all for watching. We appreciate it. Talk to you next week on Blue Table Talk.